Have you ever checked your blood pressure and noticed that the top number was high, but the bottom number looked completely normal? If so, you might be dealing with something called isolated systolic hypertension. This is actually the most common type of high blood pressure, especially as people get older. With isolated systolic hypertension, the top number, known as the systolic blood pressure, is elevated, typically 130 or higher, while the bottom number, the diastolic pressure, remains below 80. A lot of people assume it's not a big deal because only one number is high. But even when the bottom number is normal, a high top number can still increase the risk of serious health problems over time. If left untreated, it can increase the risk of heart attack, stroke, and other serious cardiovascular problems. That's why understanding what isolated systolic hypertension is, and knowing whether you have it, is so important. In this video, we'll explain what causes it, who is most at risk, and what you can do to help manage it. One of the tricky things about isolated systolic hypertension is that most people don't have any symptoms at all. In fact, that's true for high blood pressure in general. Many people feel completely fine, even when their blood pressure is elevated. However, if blood pressure becomes dangerously high, especially if the top number reaches 180 or higher, symptoms can develop. These may include severe headaches, dizziness, chest pain, vision changes, confusion, or even symptoms of a stroke, such as slurred speech, facial drooping, or sudden weakness on one side of the body. If you ever experience these symptoms along with a very high blood pressure reading, seek emergency medical attention right away. So what causes isolated systolic hypertension? One of the most common reasons is aging. As we get older, our arteries naturally become stiffer and less elastic. When that happens, they can't expand as easily with each heartbeat, which can cause the top blood pressure number to rise. There are also several factors that can increase the risk, including high cholesterol, diabetes, carrying excess weight, smoking, a diet high in sodium and processed foods, and not getting enough physical activity. Although isolated systolic hypertension is often associated with older adults, we're also seeing it more frequently in younger people, particularly those who smoke, are overweight, or live a sedentary lifestyle. And in some younger individuals, there may be an underlying medical cause, such as certain hormonal conditions or problems affecting the arteries that supply blood to the kidneys. Why does this matter? The biggest concern is what can happen if it's left untreated. Over time, consistently high systolic blood pressure can damage your blood vessels and put extra strain on your heart and other organs. As a result, it can increase the risk of serious complications, including heart attack, stroke, and chronic kidney disease. It has also been linked to a higher risk of death from cardiovascular disease. Another concern is something called hypertensive heart disease. This refers to a group of heart problems that can develop when high blood pressure remains uncontrolled for many years. The good news is that identifying and treating high blood pressure early can significantly reduce these risks, which is why regular blood pressure monitoring is so important. So how do we treat this? The good news is that treatment often starts with lifestyle changes. This may include reducing your salt intake, eating more fruits and vegetables, maintaining a healthy weight, getting regular physical activity, limiting alcohol, managing stress, and avoiding tobacco products. For some people, lifestyle changes alone may not be enough to bring blood pressure into a healthy range. In those cases, medications may be recommended. Common options include diuretics, calcium channel blockers, ACE inhibitors, and ARBs. Depending on your blood pressure and overall health, your doctor may start with one medication, or sometimes a combination of medications. And if you're prescribed blood pressure medication, it's important to take it exactly as directed and not stop it without first discussing it with your healthcare provider. Isolated systolic hypertension is usually a long-term condition, which means most people need ongoing treatment. Your doctor may adjust your medication or the dosage over time. The good news is that treatment can make a real difference. It can lower your risk of heart attack, stroke, and other serious complications. And like many health conditions, catching it early gives you the best chance of managing it well. If you found this video helpful, give it a thumbs up and leave a comment below. And don't forget to subscribe to Blood Pressure Healthcare for more tips on managing and maintaining healthy blood pressure. Stay healthy, and we'll see you in the next video.